Welcome back, everyone. Dr. Abbass is back with us today, ENT specialist, the Lima Memorial's ear, nose, and throat. Today we're talking a little bit about sinusitis. Let's talk first, I guess, about the sinus cavity. Tell us what that is and what that does for our body.
So the sinus cavities are air-filled cavities that take up a significant amount of room in our head, and basically it is the organ that is responsible for conditioning and purifying the air that we breathe before it enters our lungs. So that is the most important function of the sinuses. There are other functions as well, but this is the main function.
So when we hear that term sinusitis, what's happening with our sinus cavities that's causing some issues?
Sinusitis simply means inflammation or swelling of the lining of the sinuses. This can be due to many different factors, but basically what it does, it does not allow the sinuses to function optimally in terms of making sure that our lungs remain healthy.
Are there certain symptoms to look for? I think of so many things that can affect our breathing, especially this time of year with allergies and everything, sinuses and everything else going on. Are there certain things to look for that maybe this is something we need to get checked for?
So the symptoms for sinusitis can vary, sometimes depending on how chronic it is or if it's an acute situation, but it typically includes a sense of congestion, difficulty breathing through the nose, facial pressure, headaches, sore throat, ear congestion and pressure, and nasal drainage, as well as fever in more severe cases.
Yeah, those don't sound fun at all. If people get to a certain level of those symptoms, or they're, I guess we're all guilty of this, where we maybe get used to those kind of symptoms and we don't get them checked out. But I guess what point do you get to where you think, okay, maybe I need to go see a specialist about this?
Sure, and we all get an occasional cold where we have some of these symptoms, and that's normal. Now, typically we tell people if the symptoms persist for more than 10 to 14 days, if they don't seem to be improving, if the symptoms seem to be gradually worsening, or if the normal treatments are not working. So if the typical over-the-counter treatments don't seem to be giving you any relief, then it's usually a good idea to have your sinuses examined. And
you've dealt with so many of these kind of cases and patients. I would think now it's kind of getting to be old hat where you see the symptoms and they come in and you think, okay, I know what's going on here.
Yes, it's usually, it's a classic clinical picture that we see. And we take a graduated approach in terms of trying different medications. And most of the time we are able to obtain adequate relief with prescription medications. And if not, then we try more invasive procedures in order to obtain adequate relief for our patients.
As you said, help is available. Doctor, thank you so much for telling us about it. We appreciate it.
Thank you.
You bet. Nice chatting with you. We'll be back right after this.